Hi, it's Brittany, and this is my journal article review for Health Communication Health 502, Towson University Minimester 2021. The title of my article is Public Awareness of Air Pollution and Health Threats, Challenges and Opportunities for Communication Strategies to Improve Environmental Health Literacy. So an introduction to air pollution, very basic, and communication strategies that exist. Air pollution continues to be a challenge for the United States. It's been found to be harmful to both the environment and individual health. Environmental Protection Agency considers air pollution to be a leading environmental toxin, and it's been associated with adverse health effects including asthma, respiratory illnesses, bronchitis, loss of work, and loss of school days. Accurate and timely communication about air pollution is important to mitigate harmful effects to individuals in vulnerable areas. National guidelines do exist, but little is known about the current communication effort effectiveness. Is the messaging addressing individual behavior, education, and change, as well as advocacy for structural changes, or is it just focused a little bit more on the individual behaviors? Lastly, environmental health literacy. So this is a construct with roots in health literacy and risk communication. It's an important communication tool, and it's a public health philosophy that both educates about air quality, environmental issues, and health risks, as well as encourages advocacy and community involvement for policies that reduce pollution. The research problem and the setting. So the San Joaquin Valley is in California and is home to over 4 million people. The valley regularly exceeds state and federal air pollution standards and includes 4 of the 10 most polluted cities in the United States. Weather conditions, topography, and major highways are the main reasons air pollution in this valley are so high. So the weather conditions include temperature inversions, hot summers, and foggy winters. The topography is that this area is a narrow valley surrounded by mountains and then surrounded by a lot of highway traffic. The environmental impact on the well-being of the residents is great. So reports show that they have higher rates of respiratory illness and asthma, especially with children. They have a higher premature death rate, and their overall costs that come from the unhealthy levels of ozone are close to $3 billion annually just for this region. Effective health communication about air quality and health risks must reach the appropriate audiences. It must provide local and real-time information that help them to make decisions, and it must take into account the needs of the individuals in the community. The authors of the study had 3 research objectives. They were to document existing communication strategies that try to achieve environmental health literacy for the diverse audiences that live in this area, to evaluate public sources of air pollution information, and to identify potential disparities in information quality, reach, and effectiveness. The methodology that they used was a case study approach, and they gathered research information from 3 different resources. So they got data from existing communication sources. These are national and local organizations or agencies. Examples would be the EPA has an air quality index with information. There's the California Air Resources Board, the Real-Time Air Advisory Network, also known as RAN, and Real-Time Outdoor Activity Risk, also known as ROAR. Those 2 are somewhat related, and then Healthy Air Living. Interviews with air quality experts, so regional experts, university or government affiliated, 10 total interviews were performed, and then interviews with community residents who included mothers of school-aged children. The authors believed that this population would be good because they're highly motivated. Obviously, the health of their children is important, and they would be most likely to be aware of information resources that exist, websites, apps, flag systems, etc. There were 26 total interviews performed with this group, 10 English-speaking and 16 Spanish-speaking. Just some visual displays of the different air quality communication sources that are available to the residents in this area. So we talked briefly the air quality index from the EPA. All of these have different target audiences, and the amount that they update varies. So the AQI, their target audience is the general public, but also government officials or experts, and it's updated, I believe, in real time, so you can refresh and see. There's RAN and ROAR, which we spoke about on the previous slide as well. This is distributed by the local air pollution control, and they are updated hourly. There's the air quality flag system, also distributed by the local air pollution control board, and this is updated daily with flags that are meant to help schools, caregivers, community centers, an idea in the morning of what the weather will be and whether or not outdoor activities are okay. And then the healthy air living that I also mentioned. So this is more of an outreach program. It's newer. It was created in 2005, and there's also a school program part that goes with it, but it gives suggestions on behaviors that can be taken, one new behavior a day to guard against air pollution, to help the area. And this definitely uses the most channels of communication of everything you're seeing on the slide. So they have an interactive website for students and children. They have television ads, radio commercials. They use small print media, so brochures and pamphlets. And they also have an app that you can download from their website that provides air quality alerts as well as information hourly. All right, so let's get to the data analysis and results. As far as the interview sources are concerned, there were expert information sources and public information sources. The expert sources were going to be providing direct measurements of air quality, so the EPA website or local air quality websites. The public information was a little bit secondhand, so taking that data and then having it presented on television, in radio, or print news. The experts that were interviewed perceived the public sources to be watered down and lacking details that they would want to know. And unfortunately, many residents that were interviewed were just unaware of any sources that existed. The overall lack of source knowledge was great in the sense that neither the experts nor the residents that were interviewed knew any organization or could name any organization that was responsible for measuring and communicating the air quality information. As far as the information quality is concerned, dissatisfaction from both experts and residents was reported. Residents often felt overwhelmed or powerless with the reports that were given to them because no corresponding suggestions or ideas on how to protect themselves or stay healthy existed. The messaging lacked the link between air quality and health, similar to the one before, although it provided some information, but not about health risks, especially long-term chronic exposure health risks. The messaging lacks strategy suggestions, so protective health behaviors, and science translation for the general public. So when there was some science put out there, most of the residents found that confusing or frustrating, just didn't know what to do with the numbers that were given to them. And over a third of the residents interviewed felt conflicted with decision making. So many reported that it was hard to manage the multiple information sources, especially if the information was contradictory. So if something is updated once a day, it's not going to give the same thing that's updated hourly or real time. And then as far as information reach is concerned, both experts and residents agreed that information reach to vulnerable populations was low, and that what the study found was the resident awareness about information sources was also low. So 2 of the 26 residents that were interviewed were aware of the real-time air advisory network. Only 50% of them knew about the FLAG program, which was specific for schools and community organizations and caregivers, and less than 25% actively looked at ROAR information. So the significant barriers that the study introduced were that access to technology. So a majority of these residents that were interviewed reported relying on TV and radio to get their information, not from websites or apps throughout the day. And then another barrier was the language. So only one of the information sources we saw earlier in the presentation provides information in Spanish. None of them provide information in the indigenous Mexican languages, and the rest of them are all English. So a quick discussion to wrap things up. We saw that, or in the beginning, we mentioned that effective messaging has the potential to reduce adverse effects of air pollution by educating residents and rallying support for pollution policies. What the study showed us is that current air quality communication is disconnected and confusing. Communication reports air quality information, but not underlying causes of poor air quality or behavior changes that are helpful. So attention could be given to the structural factors, the emissions, the pollutants, et cetera, that create the health hazards and that are recognized as barriers to good health and well-being. Air quality communication is lacking important science translation, and actionable steps individuals can take to mitigate their risks of chronic exposure to poor air are often not provided. So addressing specific negative outcomes, the increased risk of disease because of chronic exposure to poor air, as well as providing specific measures that individuals can take to protect themselves and or advocate for policy changes would be super helpful. And then lastly, the article gave a suggestion to redefine vulnerable groups to include everyone in the general public. We know that negative outcomes from chronic exposure affect everyone, not just vulnerable populations. So although there are populations with respiratory illnesses or children or elderly that do need to heed these warnings and be aware of them, everyone should actually pay attention to this and help to change either their own personal behavior or the policies that exist. And that was it. Here's the references slide, and thank you for your time. Have a great day.